we're very happy to have with us today the representatives from the various partners that have agreed to co-host with me. And the first one is Teresa Campbell with the Social Security Administration Office. We're just so delighted to have her with us now. Okay. And she has been so gracious just to, respond to my emails because, we don't call anyone anymore, right? Everything's online. And so she's been so gracious to say, oh, yeah, let's do it. And so I'm looking forward to, having a long partnership with her as long as I'm with the district, right? We also have with us two wonderful ladies that I've worked with now in the Kaiser program. They weren't here 17 years ago, but I sure am glad they're here now. Of course, you all know Sunny Smith. She is the regional territory manager that covers the LACCD account for CalPERS. And she's with Kaiser Permanente. And we also have Julie Brady. Now, Julie was brought in by Sunny. Sunny has some real good contacts, everybody. I mean, she hasn't disappointed me yet. But Julie is just so wonderful. She is the most knowledgeable Medicare person and how it works in our crazy benefit structure, like no one else I know so far. And so we're very delighted to have her back to give her wisdom following Teresa's presentation regarding Social Security about how that Medicare is going to play or coordinate well with your retiree health benefits. The district's going to continue to pay for you. Oh, we are such blessed people at the district, aren't we? They get the blood and sweat out of us, right? But nonetheless, we get a nice carrot at the end, right? And for those of you who are taking that SRP on before June 30th or by June 30th, I'm very jealous, okay? Very. But congratulations nonetheless, okay? Nonetheless, we just cannot forget this lovely lady, although I can't get her yet to turn her camera on for any meeting. But nonetheless, my cohort in the district office and the Health Benefits Unit and the last woman standing with the health benefits team, Carita Hughes is here, and she'll be providing a presentation as well. Now, I am expecting Sandy Cisneros and I believe Tammy Rowe. Tammy is from Anthem and Sandy is from United Healthcare to come in and discuss for us the wonderful coordination process when you get into the Medicare ages and how your health plan that the district will continue to pay for at 100% for most of you, how that is going to coordinate when Medicare becomes your primary health plan or primary insurance. And so hopefully they'll make it. And I'll make sure that you move into those rooms with them, but that will be later on in the session. So first, let us begin with our presentations. It is very, very critical that we hear some really important things about how the health benefits and how the Medicare Advantage plans are going to continue, but most critically now, what I have come to see in these past SRP workshops and these retirement workshops is that a lot of people are confused about Social Security and Medicare. So we're going to go to the experts, right? Let's talk to Teresa Campbell, or better yet, let her talk to us because we need her wisdom. So I'm turning the mic over to you, Teresa. Take it away.
Okay, thank you. Thank you so much. And thank you to all of you for being here. So that presentation is hard to follow because it was so excellent. So thank you for sharing that video. It's really so much fun to see. So I've worked for Social Security for over 29 years in both supervisory and technical positions. And the thing about retirement is we're all going to make different decisions about retirement. There's no one size fits all. We just want to make sure that you have all the information that you need so that when it's time, you'll be able to make an informed decision about when to retire and when to start receiving your Social Security and your pension. So this presentation is going to cover how we compute a Social Security benefit, and what about your spouse? What can your spouse expect? And your ex, because your ex may be able to draw Social Security on your record. And we'll discuss Medicare, the various parts of Medicare, and when you should file for Medicare. And we're going to talk about My Social Security and the socialsecurity.gov online services. And we'll discuss offsets. There are two distinct and separate offsets that affect public employees when they receive a pension from a job where Social Security is not deducted from your pay. One affects your own Social Security, and the other affects any benefit that you could receive as a husband or wife, widow or widower on your spouse's Social Security record. Okay, so retirement. So we have all worked very hard. We've worked a lot of years, and we're getting ready for retirement. And we want to make sure that you receive the benefits that you deserve so that you'll be able to have a comfortable retirement and really enjoy those years. Now, nobody can get Social Security unless you have enough credits. And the only way that you can get a credit is by working and paying Social Security tax. So for each $1,470 in Social Security covered earnings, you have earned 1 credit. You can earn up to 4 credits a year before we stop giving credits. So that this year, if you had earnings of $5,880, you have earned all 4 credits that you could possibly earn this year. You need 40 credits in order to receive a Social Security payment. So if you have 10 years of work in jobs where Social Security tax was withheld from your pay, then you should have your 40 credits. And that means you will definitely be able to receive a Social Security payment. And you don't need to earn those credits consecutively. So just over your lifetime, once you earn a credit, you always have that credit. So over your lifetime, if you have those 40 credits, you will receive a Social Security retirement payment. Okay, so this is how Social Security computes a benefit payment. First, we look at your wages throughout your lifetime, and we adjust your wages for inflation, or we adjust your wages for changes in wage levels over time. And then we find your highest 35 years of work. We add all your wages together for those highest 35 years, and we divide it by 420. There's 420 months in 35 years. And the result is your average index monthly earnings, or your average earnings throughout your lifetime. So when Social Security computes a benefit check, we always use your highest 35 years of earnings. But remember, you only need 10 years of work under Social Security to receive a benefit check. So what happens if you only had 10 years of work? That means for 25 years, we're using 0 in the calculation. Okay, then there's a 3-tier calculation that we apply to your average index monthly earnings. We take 90% of the first 996 hours, 32% of the next 5,006, and if there's anything left over, 15% of the remainder. We add it together, and that would be your payment at your full retirement age. So for our example here, we have somebody whose average monthly earnings, so throughout his lifetime, his average monthly earnings was $7,000 a month. We take from that $7,000, we take 90% of the first 996, and we get 896. Then we take 32% of the next 5,006, and we get 1,602. There's 998 left over. We take 15% of that, and we get 150. This person's Social Security payment at their full retirement age would be $2,648. So there may be a couple things that you might notice. One is that Social Security pays a weighed benefit. That means the lower your average monthly earnings, the higher the percentages that you will receive from Social Security. And the reason we do that is because Social Security is trying to control poverty. And so if you are a low-wage earner, you may receive a 90% rate of return in a Social Security payment. If you're an average wage earner, you will have maxed out your first tier, and you'll have the lion's share of your earnings in that second tier, and you'll get about a 40% rate of return in a Social Security payment. If you're a very high wage earner, then you will have maxed out your first tier, maxed out your second tier, you'll have a lot of earnings in that third tier, and you'll get about a 24 to a 32% rate of return in a Social Security payment. So the more years you worked under Social Security and the higher your earnings, the higher your benefit check will be. But it's a lower percentage than the worker who had less years of work and paid less into Social Security. Now, some of you will be affected by windfall elimination provision or WEP. Not everybody. So I know in this group we have some people who are affected by windfall elimination and some who are not. If any part of your pension is based on work that was not covered by Social Security, so Social Security tax was not withheld from your pay while you were earning your pension, then you will be affected by the windfall elimination provision. So windfall elimination provision is a modified formula. So under the normal calculation, you would receive from your average monthly earnings 90% of the first 996. The windfall elimination provision substitutes a factor of 40% for the first 996 hours in earnings. The rest of the calculation is exactly the same. The most that your Social Security can be reduced because of the windfall elimination provision is $498 a month. So that's the maximum amount that your Social Security can be reduced because of your public pension, no matter how high your public pension is. So when we compute a Social Security benefit using this modified formula, instead of getting 90% of the first 996, you would get 40% of the first 996 hours in earnings. So let's say that your average monthly earnings was $2,500. Okay, so it's lower than the last calculation because oftentimes public employees don't have a lot of years where they worked in jobs where Social Security tax was withheld from their pay. So instead of 90% of the first 996, it's 40%. And instead of 864, that first tier is 398.40. Okay, so there's $1,504 left over for the second tier. 32% of that is $481.28. There's no earnings at all for that third tier. So this person's Social Security benefit at their full retirement age would be $869. So there's a reduction of $498. So this person has the maximum amount to offset because of windfall elimination provision. Now, before you started working in a job where Social Security was not withheld from your pay, you may have had jobs where you were paying into Social Security. If you had 30 years or more of work where Social Security pay was withheld from your wages and your wages were actually substantial, so not just earning your credits, but actual substantial earnings, then you get that same 90% rate of return for the first tier that everybody else receives. If you had between 21 and 29 years of work where Social Security was withheld from your pay, then the windfall elimination provision applies to you on a sliding scale. If you had 20 years or fewer where Social Security was withheld from your pay, then the windfall elimination provision applies to you completely. So if you want to get an accurate estimate of how much your Social Security benefit is going to be, so if you were one of those employees who is earning a pension and you are not paying 6.2% of your wages are not going to Social Security. So if you were in that category, to get an accurate estimate, you would go to our WEP calculator. So you would go to SSA.gov, and then you will be able to get an accurate estimate of what your Social Security payment is going to be. You would want to create a My Social Security account, put in all your wage information into this windfall elimination provision calculator. So all of your Social Security covered earnings, you would put that amount into the calculator, and you will be able to receive an accurate estimate. Okay, the other thing that affects your Social Security benefit is your age when you start to collect your benefit. So the increase in the full retirement age, that was part of the 83 amendment to Social Security. So if we think about, our parents or our grandparents, their full retirement age was 65. But for most of us, our full retirement age is going to be older than age 65. So if you were born between 1943 and 1954, your full retirement age is 66. You can still retire as young as age 62, but your benefit would be reduced 25%, and that's a permanent reduction. If you were born 1960 or later, your full retirement age is 67. You can still retire as young as age 62, but your benefit will be reduced 30%, and that's a permanent reduction. Okay, the other thing that affects your Social Security benefit amount is wages. So if you are working and you have reached your full retirement age, which is going to be different for all of us, or for many of us, but if you are working and you have reached your full retirement age, you can continue to work and make as much as you want, and it will not affect your Social Security payment. But if you are younger than your full retirement age, there is an earnings limit. It's $18,960. If you work and make more than that, for every $2 in earnings over that, one is withheld from your Social Security payment. So when you retire, when you file your Social Security retirement claim, if you're younger than full retirement age, we will ask you for an earnings estimate, and then we will withhold full checks to eat up those excess earnings. The year that you turn full retirement age, for the month before the month you turn full retirement age, the earnings limit is $50,520. So let's say that you turn full retirement age in May. Between January and April, if you have earnings below $50,520, you can receive those 4 Social Security payments. Your permanent check will be reduced a little bit because you receive 4 extra payments, but you can do that if you wish. That's a choice that you have. Okay, and taxes. So that's another thing to consider. So there's good news and bad news here. The good news is the state of California does not tax a Social Security payment. So some states do, but California does not. But the bad news is you will probably pay federal tax or additional federal tax because of your Social Security benefit. If you file a tax return as an individual and your combined incomes between $25,000 and $34,000, up to 50% of your benefits is subject to taxation. If your other income, 100% of it is usually subject to taxation. If your income is more than $34,000, up to 85% of your Social Security benefits may be taxable or subject to taxation. If you file a joint return and you and your spouse have combined income between $32,000 and $44,000, up to 50% of your benefits is subject to taxation. More than $44,000, up to 85% of your benefits may be taxable. So when you file for Social Security, if you want us to withhold federal tax, we can do that. You would just complete Form W-4B, check off the percentage you want withheld, and then you can always change that. You can always increase or decrease the amount you want withheld. Okay, so a lot of times people say, because you want to think about things like taxes, that your Social Security might be subject to taxes, or maybe you're still working. You'll want to take that into consideration when you decide when you want to retire. But you can start receiving your Social Security benefit anytime between age 62 and 70. Maybe you're going to retire from your job at age 52 or 55, but decide you want to wait until age 70 to start receiving your Social Security benefits so that you can completely max out your Social Security benefit amount. If you start to receive your benefits early, prior to your full retirement age, the decrease in your benefit amount is about 0.5% for every month that you start to receive it early. If you receive your benefits later than your full retirement age, so you delay taking your retirement benefits, the increase is 0.2% or 8% per year. So 0.2% for every month that you wait past your full retirement age. So if your full retirement age is 66 and you wait until you are 70, you will receive 132% of the full benefit amount. If your full retirement age is 67 and you wait until you are 70, you will receive 124% of the full benefit amount. Once you turn age 70, your benefit amount is maxed out. So don't wait past age 70 to start collecting, because then you're just missing out on your benefits. Okay, and of course you want to think about life expectancy. So we all we never know. We never know what's going to happen in our life. But you can kind of think about your health and how long your parents lived. A man who turns age 65 today can expect to live on average until 84 years old. A woman turning age 65 can expect to live on average until 86.5 years old. And those are just averages. About 1 out of every 3 65-year-olds will live to be at least age 90, and 1 out of 7 will live to be at least age 95. So the point of this also is that your retirement might last a lot longer than you think it's going to. So when you make decisions about your retirement and when to start receiving your Social Security benefit, make sure that they're informed decisions. Okay, so retirement experts have typically they refer to retirement as the three-legged stool. It consists of your Social Security, your pension, and your savings and investments. Well, most employers don't offer defined benefit pension plans any longer. And how many of us have done as well as we had hoped with our savings and investments? So for more and more people, Social Security is the strongest leg of that three-legged stool. But Social Security was never meant to be a person's only income in retirement. And as we said, for the average wage earner, Social Security will only replace about 40% of your average monthly earnings. And a financial advisor will tell you that you need at least 70 to 80% in order to have a comfortable retirement. Okay, so besides you, who else could qualify for a benefit? Well, a spouse. So a spouse who didn't work or a spouse who didn't earn very much could qualify for 50% of the worker's benefit at his or her full retirement age. And then it would be reduced if the spouse receives it early, prior to full benefit amount. So your spouse needs to apply for benefits on their own record first, and if their benefit is less than 50% of yours, they would receive that additional payment to equal 50% of your benefit. Anything paid to your spouse does not reduce your benefit, so it's in addition to what you collect. So if my Social Security will be $2,000 a month, and my spouse's benefit amount will be $700 a month, I get the $2,000 I earned, he gets the $700 he earned, and then he would get an extra $300 to equal 50% of my benefit amount. Let's say my spouse doesn't have his 40 credits. I get my $2,000, and then he would get $1,000 on my record. and my spouse and I need to be married for a year before he can collect on my record, and my spouse can't collect until I start collecting. So he can't collect on he can collect on his own, but he can't collect on mine until I start collecting. Okay, and your ex. So your ex could qualify for benefits on your record too if you were married for at least 10 years. So 10 years is what legally protects your ex for benefits on your record. Your ex needs to be unmarried currently unmarried, in order to collect on your record. Now, you don't need to be collecting yet in order for your ex to collect on your record. So they can start collecting if you're deciding to hold off so that your benefit amount on your own record will be higher. So, and of course, your ex needs to file for benefits on their own record first. And if their benefit amount is less than 50% of yours, they would receive this additional payment. So anything paid to your ex does not take away from your benefit amount, and it doesn't take away from your current spouse's benefits either. Okay, the other provision that affects government workers when they receive a pension from a job where Social Security is not withheld from your pay is government pension offset. Government pension offset is literally an offset where 2/3 of your government pension offsets anything that you could receive as a husband, wife, widow, or widower on your spouse's record. Okay, so now let's say that my government pension, and this is my pension from a job where Social Security tax was not withheld from my pay, my government pension is $1,200 a month. 2/3 of that would be $800. If I would have received a spouse's benefit of $750 a month, there would be nothing payable because my government pension would completely offset it. Okay, so the loss of a loved one can be both emotionally and financially difficult. So Social Security has that safety net when the unexpected happens. So first of all, when you pass away, your surviving children and your surviving spouse could qualify for Social Security benefits, and we use the regular normal calculation. So we don't use the modified windfall elimination provision calculation. So everybody has the same calculation when we compute a survivor benefit. But when you pass away, your children would qualify for survivor benefits up until age 18 or 19 if they're still in high school. If you have an adult child who was disabled and the disabling condition occurred prior to age 22 and they are unmarried, then your child can qualify for Social Security survivor benefits as a disabled adult child. And most of the time, 96% of the time, the benefits last the rest of the child's lifetime. And then your widow or widower can receive benefits as young as age 60 or 50 if they are disabled, or a young mom or dad can receive benefits if they are taking care of your child who is younger than age 16 or your adult child who is disabled. A widow or widower would no longer qualify for the survivor benefits if they remarried, unless they remarried after age 60. So a remarriage after age 60 will not affect the survivor benefits for your spouse. Okay, so when you pass away, your surviving spouse would receive 100% of your benefit amount if they wait until their full retirement age to start collecting. If they receive as young as age 60, they would receive 71.5% of your benefit amount. So your surviving spouse can claim benefits anytime between age 60 and full retirement age. The later they wait, the higher the payment amount would be. Okay, so surviving spouses have different strategies. We call them claiming strategies. So let's say that you are receiving benefits as a surviving spouse. At age 62, you would contact Social Security to see if the benefit on your own record was higher. If it's not higher, if you're already receiving the higher benefit amount, you would do nothing. But if you could get higher on your own record, you can switch over now, or you can wait into your full retirement age and get 100% of your benefit amount, or you could wait until age 70 and get those delayed retirement credits and really max out your benefit amount. Or let's say the benefit on your own record is smaller than your spouse's, you can take your retirement benefits at age 62 and then switch to the survivor benefit at your full retirement age and get 100% of that benefit. So it's usually better if you can afford it to take the smaller benefit first and let the other benefit continue to grow and switch over to that other benefit later in life when you're going to need more income. So if you are a widow or widower, we would like to talk to you a couple of months before you turn age 60 so that we can go over the numbers with you and you can make an informed decision about which benefit you want to begin and when. Okay, and Medicare. So Medicare is actually run by a different federal agency. It's run by CMS, or the Centers for Medicare and Medicaid Services. But you apply for Medicare at the Social Security office, and we have a lot of information about Medicare. So Medicare has 4 main parts. Part A is for hospital visits. The Medicare tax that you pay, 1.45% of your wages goes to Medicare. That's for Medicare Part A. If you have your 40 credits under Medicare, then your Medicare Part A will be premium free. Medicare Part B is for doctor visits. There is a premium for Medicare Part B. If you have A and B, then you have what's called Original Medicare, and it will cover 80% of your approved medical costs. Once you have Medicare A and B, you can choose to sign up for a Medicare Part C plan. Those are the HMOs and the PPOs that are offered by private insurance companies. All of the Medicare Part C plans have been approved by Medicare, and they combine everything that's under A and B, and they usually have a Part D plan as well. So they usually combine all 3 together. So you need A and B before you can sign up for C. Most of the Part C plans do not charge you anything. So what you're paying for Part B already is covering your costs for Medicare Part C. Medicare Part D is the prescription drug plan. You can sign up for Part D as a standalone plan. So you can have A and B and sign up for D, but most people have D as part of their Part C plan. Now, let's say that you don't want a Medicare Advantage plan because those are optional. You want to stick with A and B only. You want Original Medicare only. Well, Original Medicare only covers 80% of your approved costs. So if you're going to do that, we would recommend that you sign up for a Medigap policy with an insurance company to cover that 20% that Original Medicare doesn't cover. Okay, so even though full retirement age is going up, Medicare age is still 65. Or individuals who have received Social Security disability for 24 months become eligible for Medicare. Individuals who have ALS can receive Medicare without that 24-month waiting period, and individuals with kidney failure who are on dialysis can get Medicare even if they're not receiving Social Security disability. So Medicare will pay for the dialysis. Okay, so if you're receiving a Social Security payment when you turn age 65, we sign you up for Medicare A and B automatically. We assume that you want it because almost everybody does. The initial enrollment period for Medicare is 3 months before you turn age 65 through 3 months after you turn age 65. So if you don't receive a Social Security payment, we recommend that you sign up for Medicare 3 months before you turn age 65. If neither you nor your spouse are working and you don't have health insurance based on active employment, then we recommend that you sign up for Medicare A and B during your initial enrollment period. So if you don't have health insurance based on your active employment or based on your spouse's active employment, Medicare is your primary health insurance. If you have health insurance through your job or through your spouse's job, through your active employment, then that insurance is your primary insurance and Medicare is your secondary insurance. You do not need to sign up for Medicare Part B during your initial enrollment period. You have a special enrollment period. Your special enrollment period ends 8 months after you stop working. Now, if you have missed your initial enrollment period and you don't qualify for a special enrollment period, you will only be able to sign up for Medicare Part B during the general enrollment period. That's January through March of every year. It's effective in July of that year. And there's a 10% penalty for every year you could have had Part B and you didn't have it, and that penalty is permanent. Okay, so the standard premium for Medicare Part B is $148.50 a month. If you receive a Social Security payment, the premium is taken out of your Social Security payment. If you don't, then you are billed quarterly for the Part B. But wealthier seniors do pay more. So an individual with a modified adjusted gross income of more than $88,000 or a married couple with modified adjusted gross income of more than $176,000 will pay more for their Part B. So we look at your income from 2 years ago to determine what your Part B premium will be. If you've had a life-changing event, and that includes a marriage or a divorce or no longer working or going from full-time to part-time, then we can look at last year's income or this year's anticipated income if it's more advantageous. Okay, now let's say that you turned age 65 and you are still working and have insurance through your job, your active employment. So you went to SSA.gov and you signed up for Part A and you refused Part B, but now you're going to stop working, so you need your Part B. There's 2 forms that you need, and you can get these from the SSA.gov forms page, the CMS 40B and the CMS L564. The 40B is the form that you complete saying, I want my Part B to start now. The CMS L564 is the form that you take to your employer. They verify that you were or are employed and covered by the group health care plan. You might have 2 sets, one set for yourself and one set for your spouse, and you can fax the completed forms to us and we will sign you up for your Part B, and there will not be a penalty as long as you did this within 8 months of when you stopped work. Okay, so and at Medicare.gov, you can create a My Medicare account to check your Medicare information, such as your Medicare claims as soon as they are processed, and important Medicare-related information specific to you. You can find your eligibility, entitlement, and preventative service information, check your health and prescription drug enrollment information, view your Part B deductible information, manage your prescription drug list and other personal health information, and create an on-the-go report that allows you to print your health information to share with your healthcare providers. Okay, and here is socialsecurity.gov, our online services. So we have all kinds of retirement planning tools and calculators to help you figure out what your Social Security benefit is going to be so that you'll be able to make those decisions about when to start your Social Security payment. My Social Security is a convenient and secure suite of services designed to put you in control of your own personal Social Security information and to help you manage your Social Security when you're ready to start receiving your payments. So you can conduct your business with Social Security without leaving the comfort of your house. So almost everything can be done online. To open a My Social Security account, you would go to ssa.gov/myaccount, and then sign in or create an account. And then you would provide some personal information to verify your identity. So we ask you some out of the wallet questions. Or if you have a smartphone, you can take a picture of the front and back of your ID and use that to authenticate yourself. Then you choose your username and password, and then every single time you log in, we will either text or email you a security code. So that's an extra layer of security. If you receive benefits or Medicare and you create a My Social Security account, you can now get your notices that we would have mailed to you online. You can request your replacement Social Security card online as long as you're at least age 18, a U.S. citizen, and you have a driver's license or a state ID. You can get your benefit verification letter. You can check your benefit and payment information in your earnings record. You can change your address and phone number or direct deposit information. You can request a replacement Medicare card or get a replacement 1099 for taxes. If you do not receive benefits, you can create a My Social Security account to view your retirement benefit estimates at different ages or dates when you want to start receiving benefits. So maybe you want to start when you're 68 and 2 months old. You can get that information online. You can view possible spouses benefits. You can request your replacement Social Security card if you meet those criteria. You can check the status of your application or appeal. You can get proof that you are not getting benefits, and you can get your Social Security statement to review, including the estimates of your future retirement, disability, and survivor benefits. We would ask you to review your earnings record and make sure that the earnings amount that we show on there is correct. It usually is, but we want you to look at it and verify that it is. And the estimated Social Security and Medicare taxes that you've paid. Okay, well, thank you for your attention, and we wish you a safe, happy, and secure tomorrow.
So with that, I'm going to move forward and ask Julie Brady to please take the mic. She is with Kaiser Permanente, and she's going to talk about the Medicare enrollment process as when you're with CalPERS in retirement or even before retirement, but turning age 65 and working. She's got a lot of great information, as well as Teresa had. Her take on it is going to be from the health plan perspective, so that you can get an understanding or begin to get an understanding of how Medicare and your health plan coordinate. So with that, Julie, take the mic.
Thank you. So I am going to be talking to you about Medicare and then how your Medicare coordinates with your CalPERS health coverage in retirement. Some of what I'm going to tell you, at least at the beginning of my presentation, will be, a little bit repetition from what Teresa did with her Social Security presentation. But I know that with information like this, sometimes you need to hear it a few times just to kind of get something new each time. I know Medicare can seem very complicated, and it is not exactly easy, but we're hoping that we can help you break it down a little bit.
Wonderful.
So let's start with understanding the basics of Medicare. So who can join Medicare? For us in this presentation today, I'm really focusing on we're turning 65. So that's the main eligibility criteria. That's where the most of the population is you become Medicare eligible because you are turning 65. There are other categories. If you're under 65, but you live with a disability and you've gone through that 2-year waiting period and you're eligible for Social Security disability, or if you're diagnosed with end-stage renal disease, which requires a kidney transplant or kidney dialysis. And then if you're diagnosed with amyotrophic lateral sclerosis or ALS, also known as Lou Gehrig's disease. But again, we are going to be focused on what happens when we are turning 65. So what's Medicare? It's a federally funded health insurance program that was established in 1965. It is administered by the Centers for Medicare and Medicaid Services, or CMS. Again, as was mentioned earlier, though, what can be a little confusing is you are going to be enrolling in Part A and B through Social Security, but CMS administers the actual covered services. So Medicare includes 4 parts. You have Part A, which is your hospital insurance, and Part B, your medical insurance. Together, those are known as original Medicare because when Medicare was first established, that's what it included, Part A and B. Then we also have Part D, which is your outpatient prescription drug coverage. And then you have something called Part C, or Medicare Advantage. Part C is not a distinct part of your medical benefits. It's more of a way some of you are going to get your Medicare medical services. So Part C will include your Part A and B services, and then in many cases, it also does include Part D, outpatient prescription drug coverage. So for CalPERS, your Part C, or Medicare Advantage plans, include the SHARP program in San Diego, the United Healthcare National PPO plan, and then the Kaiser Permanente Senior Advantage plan. All of those plans do come with Part D. Some of you are not going to enroll in Part C. You're going to have your A and your B coverage, but you're going to be looking at one of CalPER's Medicare supplemental plans, also known as Medigap plans. And those plans are the Anthem plans, so PERS Care, PERS Choice, or PERS Select. So keep that in mind. Some of you are going to have Medicare Part C. Some of you are going to have a Medicare supplemental plan. You're still going to get the same covered benefits. So let's look a little bit more closely at Part A. This is going to cover you when you are hospitalized in an inpatient setting, when you're getting skilled nursing care, hospice care, or home health care. Part A is considered an entitlement or an earned benefit. So if you have paid into Medicare for 10 years or 40 quarters, you will have no additional premium for your Part A. Some of you may not have paid into Social Security, but you may have been paying into Medicare. So if you're not certain, if you're eligible, if you've met those 40 quarters or 10 years paying into Medicare, you should contact Social Security to find out if you are eligible under your own work history, or you also could potentially be eligible under a spouse or a former spouse. There is a calculation set up where you could pay for your Part A premium if you don't meet those the number of quarters that you need. But if you're eligible for retiree health insurance through LACCD and you've not qualified for premium-free Part A, we do recommend that you contact LACCD for your options there. Likely you will just be staying on a basic CalPERS health plan rather than enrolling in Part B and A and then a Medicare plan. So Part B is your outpatient coverage. So this is going to cover you for your doctor's office visits, your specialists, your lab work, radiology, any durable medical equipment such as your CPAP machines, dialysis, and some preventive services. Now, while Part A was considered an earned benefit because you paid into Medicare taxes while you were working, Part B is not. There is a monthly premium associated with Part B. If you're getting Social Security, when you go to register for Part B, that monthly premium will be taken out of your Social Security check. There's something called a late enrollment penalty, and I'm going to talk about that before I look at the Part B premium amounts themselves, because we can sometimes get distracted when we see the financial numbers on the next slide. So this late enrollment penalty, it is 10%. It's a 10% penalty on the base Part B premium for each 12-month period you failed to enroll in Part B when you were first eligible. But the good thing about this is if you're working beyond 65 and you're getting coverage through LACCD, you do not need to enroll in Part B. You can defer your Part B, and then you will not have a Part B late enrollment penalty. And that would be the same for your spouse. So maybe you are younger, but you have a spouse who's turning 65. As long as you continue to work, that spouse who's older than you and becoming Medicare eligible, they also can defer enrollment in Part B, and they will not need to pay that Part B premium. So putting that piece to rest, let's look at the Part B premiums. They are subject to change each year. They're usually released around October for the upcoming calendar year. They are based on how you file your taxes, and it's looking at your adjusted gross income from 2 years prior. So what you're looking at here is Part B premiums for 2021 that would be based on your adjusted gross income from the tax return you filed for 2019. So you can take a moment, find out where you are in this chart. The base Part B premium for 2021 is $148.50 for people who are single filing individually with an adjusted gross income of $88,000 or less, or married filing jointly with an adjusted gross income of $176,000 or less. As your adjusted gross income goes up, so can your Part B premium. Let's take a married couple with an adjusted gross income of $250,000. Their Part B premium for each person enrolled in Part B would be $297 per month. So everything on this chart in that blue column is per person and per month. Now, you will be paying this directly to Social Security if it's not getting taken out of your Social Security check. You may note that if you retire closer to 65, that 2-year look back for the first year or two, we'll be looking at your income as an active employee. So when you're 65, it'll be your tax returns from the 2 years prior when you were still working. The same thing with age 66. You may find that you're not going to be paying a more level Part B premium based on your retirement income until 67. The next slide, let's look at those people who are married, but they file separately from their spouse. So they have a bit different chart. It's still the same base Part B premium of $148.50. If that individual who's married but filing individually, their adjusted gross income is $88,000 or less. It does jump up significantly once you're above 88,000. So in that case, the next bracket would be $475.20, and so on. So you may want to consider how you're filing your taxes in the few years leading up to your retirement if you're able to. It should be something that if you're working with any retirement planner, that they are taking that into consideration as you're nearing retirement. Let's talk about how to enroll. So everybody has an initial enrollment period when they're first eligible for Medicare. Most of us are eligible on the first of the month of our 65th birthday, unless you were born on the first of the month. And I often find in an audience this large, there's probably somebody who was born on the first of the month. In that case, you are eligible the first of the prior month. So we all have this 7-month window that starts 3 months before the month we're eligible and goes through 3 months after. So my birthday is November 15th. I'm going to be eligible for Medicare on November 1st. My initial enrollment period will begin August 1st, and it will go through the end of February. Had I been born November 1st, my eligibility month would start October 1st, and then my initial enrollment period would start 1 month earlier. So I would be able to start enrolling in July, and then my initial enrollment period would end at the end of January. If you're already getting Social Security benefits, you're automatically enrolled in Part A and B, and you're sent a Medicare card, and your A and B effective date will be the first of the month that you are eligible for Medicare. This is because they assume that you are likely retired and you're going to be needing the Medicare health benefits. If you are not yet getting Social Security, so maybe you've decided to defer it or maybe you're not eligible, then you would be contacting Social Security to enroll in Part A and B, because remember, they oversee that enrollment. You can go online to enroll. You can print out the paperwork and send it in. You also can, as offices start reopening, you can go in person. The easiest and most efficient way would be to just go online and start your enrollment that way. I always recommend that you focus on the 3 months before the month that you're eligible, so you can have everything set up and done for the first of that month. So we're thinking 3 months before, and we need to think about our working status. If we're already retired or we're retiring at 65, it's simpler. You would just go to socialsecurity.gov and enroll in Medicare Part A and B and have it effective the first of the month of your 65th birthday. That's sort of the easy piece. Then the next piece we're going to talk about later is what you need to do on the CalPERS end. Now, if you're still working and either you're turning 65 or you have a spouse who's turning 65, what you or that spouse does is slightly different. You will still use that 3 months before in that beginning of the initial enrollment period, but you're just going to enroll in Medicare Part A, and you're going to defer your Medicare Part B because the coverage you have under CalPERS is considered primary to Medicare. So the good thing to remember for this is Part B has a cost, and there is no need for you to start paying that Part B premium until you are fully retired. So then, for those people who are going to be working beyond 65, or they're continuing to work and they've got a spouse or somebody who's over 65, then you will have what is called, at the bottom there, a special enrollment period when you are ready to retire. Your special enrollment period is triggered by certain events, such as loss of employment or retirement. So your retirement is considered a special enrollment period. And then you have the opportunity to enroll in Part B after your 65th birthday. So that becomes your new enrollment period. So you have 2 forms that need to be completed for whomever is 65 or older and needs to enroll in Part B. So the applicant completes the CMS 40B, and then your employer, LACCD, will complete the CMS L564. The forms can be found on Medicare.gov, and then they can be submitted to your local Social Security office. What you need to figure out is the date that you want your Part B to be effective, and it's usually going to be effective the first of the month that you would be getting retiree health benefits. And I'm going to show you the forms here. You've got the CMS 40B on the left side there. That is the form you complete. And then the CMS L564 on the right is what LACCD completes. And then both of those you would get back and send into Social Security. LACCD might have their own particular process for those forms, and I'll leave that up to them to explain that, but those are the 2 forms that you would need. Now let's move on to Part D. So Part D is your outpatient prescription drug coverage. And this one is a bit simpler because even though there are different ways to get your Part D coverage, many pharmacies offer their own Part D coverage, many health carriers have their own Part D coverage, you are going to have the Part D prescription drug coverage that comes with the Medicare plan you choose through CalPERS. You won't need to do anything else to enroll in any other Part D plan. So if you are going to go with Kaiser, you'll have Kaiser's Part D plan. If you choose the United Medicare Advantage plan, that has Part D. Sharp as well, and then the Anthem, PERS Care, PERS Choice, and PERS Select. With that, you will be getting Optum Rx as your Part D prescription drug coverage. So don't enroll anywhere else. Don't, if you are at a Costco or a CVS or some drugstore, don't apply for their Part D benefits, because you would then jeopardize the Part D coverage you have through CalPERS. Now, some of you may find you will be assessed something called the Part D IRMA, the Income-Related Monthly Adjustment Amount. So it is a Part D higher income premium for those retirees who have a higher income according to CMS. So if you found that you were paying, if you put yourself in a category when we were looking at our Part B, if you found you were paying more than the $148.50 as the base Part B premium, you will be subject to a Part D IRMA. So for our married couple filing jointly with the $250,000 adjusted gross income from 2 years prior, they are going to have a Part D IRMA bill of $31.80 per person per month. That will get taken out of your Social Security check if you're getting Social Security. Otherwise, you would be billed quarterly, and you could pay it the same way you're paying your Part B premium. So you can notice that all of the adjusted gross income levels are just as they were for Part B. It's the same 2-year look back. And the federal government also releases the Part D IRMA amounts later on in the fall. And then when those are released, you get from Social Security a notification of what your Social Security benefits are going to be, and then what the cost of your Part B premiums will be. And then if there is a Part D IRMA, that will also be provided to you in that mailing. Now, there's also something called the Medicare Low Income Subsidy, and this is an extra help program for Medicare beneficiaries who have may have more limited income and resources in retirement. So this is a way to provide some extra help for Part D premiums and outpatient drug copayments. You need to be below certain income thresholds based on the size of your household. I would recommend, if you think that you might be eligible for this benefit, to either contact your local Social Security office or your local Medi-Cal office. You would register for this plan, and then you actually get the low-income subsidy benefit from your Part D provider. So it can be a little bit confusing, even though it's administered by CMS. CMS sends the money to your Part D plan, and then that plan passes it on to you. So if you're in the Kaiser plan and you're eligible for an LIS, you would get that subsidy actually through Kaiser. So I've already talked about this. This is your Medicare coverage options. So number one, there is Original Medicare. It is a coinsurance product, so there's deductibles and coinsurance. Some people stay with Original Medicare and they just pay the deductible and they pay the coinsurance. But for those of you staying with CalPERS, which I believe will be the majority of you, you're going to be picking a plan that is either a Medigap or Medicare supplemental plan, such as those Anthem plans, PERS Care, PERS Choice, PERS Select, or you'll be selecting a Medicare Advantage plan. The plans themselves are going to be very similar. A lot of the differences are related to the financial structure and actually how CMS pays the health plans themselves. But for your purposes, the Medigap or Medicare supplemental plans, they close up that deductible, and then normally they are reducing any coinsurance from that standard 20% down to something else. In the case of the Anthem PERS plans, basically the coinsurance has been eliminated. So you'll have very few out-of-pocket costs when you actually go see any provider for your Medicare needs. For the Medicare Advantage plans, they also have no deductible. And rather than a coinsurance, they have a co-payment structure. So when you go to the doctor, the Medicare Advantage plans with CalPERS all have a $10 office visit. Emergency room visit, I think, is from between $35 and $50. But other than that, you have very few out-of-pocket costs, again, when you go seek medical services. There's actually one more thing I want to talk to just in general before I get into the CalPERS Medicare enrollment process, and that's just talking about all of the Medicare plans under CalPERS. In some cases, you are required to see providers that are within that plan's network. So Kaiser's a good example. If you enroll in our Medicare Advantage plan, you are agreeing to see all Kaiser doctors, go to Kaiser hospitals, Kaiser pharmacies, etc. If you do go out of network and see a provider without either prior authorization or it being an emergency or urgent care situation, you are responsible for the full cost for any of those services. The United plan is a nationwide Medicare Advantage PPO plan, and the costs for in-network or out-of-network are the same. You just need to make sure that the provider you see accepts Medicare, and if they're not a United provider, they're willing to bill United. You do always have emergency and urgent care, though, anywhere you go, whether it's within the state or the country or the world, on all of these plans. So when things are starting to open up and we're able to travel again, you are only responsible for your copayment or coinsurance for any particular service that you get in an emergency or urgent care situation outside of your service area. So then switching to the CalPERS Medicare enrollment process, as a good reminder, it is a requirement to maintain CalPERS health benefits in retirement, that if you're 65 or older and you're eligible or entitled for premium-free Part A, that means you paid into Medicare for the 40 quarters or the 10 years, that at that point you must enroll in Part B and make those Part B premiums. There may be some situations where you're reimbursed for a Part B premium on your CalPERS, your warrant, but you still need to make those payments directly to Social Security. There's no way that LACCD or CalPERS can somehow pay that Part B premium on your behalf. If your current CalPERS basic health plan offers a Medicare health plan, you will be automatically enrolled in that plan unless you make a change. So there are some CalPERS basic plans that don't have, in 2021, a Medicare option. Blue Shield is a good example. But for Kaiser, if you're in the Kaiser basic plan and you're transitioning into Medicare, if you don't make a distinction as to what health plan you want to be in, you're automatically just continued in the Kaiser plan. You make your health enrollment election through CalPERS, not through your health plan. You don't need to contact Kaiser. You don't need to contact United unless we have contacted you after receiving your information from CalPERS. Because in many cases, we don't need to contact you. If we've gotten everything we need from CalPERS and we've processed it, then we're just going to send you confirmation materials in the mail and any other required documents that we need to send you related to your Medicare plan. All of your family members must be with the same carrier. So if you're covering a spouse and your spouse wants United, but you want Kaiser, you can't switch those out. You have to make a decision and figure out which plans are available to you based on your coverage, whether it's basic or Medicare, and then based on where you live. You can only switch Medicare health plans during open enrollment or if you have a qualifying event such as moving or retiring. And then on the flip side, this is something for you to remember, is that you still can switch Medicare plans during open enrollment. You're not sort of stuck with the same plan. You will have opportunities if you wanted to try a different plan. And then especially if you're moving, maybe you're going to be a snowbird, although we don't really have much of that in California. Maybe you're going to be the reverse and you're going to want to go somewhere with snow. That move would be an opportunity for you to change plans. And now here are the plans. So this is all again for 2021. Each year, CalPERS does approve rates and benefits and the plans, and they're usually released in July. So in another 2 months or less, you will see which plans will be available to you in 2022. But for now, the Medicare Advantage plans, there's an Anthem Blue Cross Medicare Preferred PPO plan that's available in limited parts of California. There's the Kaiser Permanente Senior Advantage plan. We are available in many different parts of California, and then other states such as Colorado, Hawaii, Georgia, Oregon, Washington, D.C., Maryland, and Virginia. Then you have the Sharp Direct Advantage HMO plan, which is available in the San Diego area. And then that United Healthcare Medicare Advantage PPO plan that is available nationwide. Then you have your Medicare supplemental plans. PERS Care and PERS Choice are available nationwide. And I believe they are also available internationally if you're going to be living outside of the United States. And then that PERS Select is available across the state of California. And now I'm going to show you some forms here. So this is what's called the Certification of Medicare Status form. So for my people who are retiring before 65, so maybe they retired at 55 or 60, or they're going to retire at 65. Remember, it's always a two-step process, but yours is a little bit simpler since you're already retired or retiring. You contact Social Security during that initial enrollment period, the 3 months before the month that you're eligible, and you enroll in Medicare Part A or B. Then, once you get your Medicare card in the mail, you can complete the Certification of Medicare Status form and then send it back to CalPERS. And they have a fax number, or you can mail it in. You're going to give them your Medicare claim number and your Part A and Part B effective date. In some cases, they are moving towards being able to do this more electronically. I still do like to share this form with people and recommend that you complete this form just to make sure that you're doing everything proactively. The next form is the HBD 30. This is if in retirement you want to make any plan changes or changes to the people that you are covering in your family. And this form is also available on the CalPERS website. And then this is what's called the ineligibility of Medicare certification form. So this is what you would complete if you're working beyond 65. Again, it's not an absolute necessity that you complete this form, but I do like to tell as many people as I can to do so, because it kind of ties everything up in a bow and you know everything's done, and then you can go about continuing to work. So you still have that initial enrollment window. So in the 3 months leading up to your 65th birthday, you contact Social Security, but you're only enrolling in Medicare Part A. There's no monthly premium for that. So you enroll in A and you defer the Part B, and then you complete this form, which lets CalPERS know, I'm not retiring. I'm not going to be enrolling in a Medicare plan. They know to stop contacting you. And then once you are ready to retire, you go back and complete the forms that I showed you on the Part B slide, that CMS 40B and then the CMS L564. And I think I just have 2 slides left here. So this one is the CalPERS website. You should all be familiar with this. You probably are more from an active member perspective, but if you're getting close to retirement, you do want to make sure you familiarize yourself with the retiree section. Since my work keeps me in that health and Medicare. That's where I spend most of my time. You can see here I'm in the section for retiree plans and rates. Everything you could ever need to know about CalPERS, the health plans, Medicare, etc., is really all in this website here. I've just pointed out a few different things. You've got that arrow there from My CalPERS. I'm sure all of you have a My CalPERS web login. It is where you'll be doing your plan changes and your open enrollment changes once you're retired. Then at the bottom, you see I've circled the 2021. CalPERS keeps all of the health plan information for the current and the prior plan year. So you can find what the rates are depending on what region you're in. You see all the health plans that are available and then all the health plan documents, evidence of coverage, summary of benefits, that health plan's dedicated website for CalPERS members, and the dedicated phone number for CalPERS members. So it's all right there. Then in the gray box on the right-hand side, there's a health plan search by zip code. So if you're going to be moving, you really want to be looking at this section of the website to click on this link, and then you type in your zip code, and you will be able to see what health plans are available to you. If you are moving to Tennessee and you type in the zip code and you are hoping that you can transfer your Kaiser from California to Tennessee, we're not in Tennessee. So you would see the health plans, the Medicare health plans that are available in Tennessee, which would be United and then the PERS Care and the PERS Select. So you would not be able to enroll in any other plan but one of those plans. That's how CalPERS works their eligibility. Those zip codes are linked into their system, and so they will prevent you from enrolling in anything else. And that wraps things up. I'm just going to leave some, this is actually, I'm sorry, this is my previous, well, you can ignore my apologies. You can ignore the Montebello Unified School District, but we do have the CalPERS phone number and Kaiser and Social Security and Medicare. I do many of these presentations each week, and it looks like I've mixed up my last slide. You will be getting information on how to contact LACCD though, and I think most of you already know how to contact them. So that is all for me.
Well, thank you so much for this, Julie.
Thank you.
Just another look at the whole process of enrolling for Medicare, and also how it affects what type of plan you're in, what you choose to do with it, with your Medicare. So wonderful. Thank you so much.
Sure. I'm going to stop sharing here.
Okay. Thank you. Right. So everyone, I've tried to answer some of the questions as best as possible. When it comes to district policies and how you maintain your retiree health benefits, the guru or the resident expert is none other than Miss Carita Hughes. So I am going to now turn this mic over to her so that she can present her information that she's prepared for you today. She will also host a breakout room when we get ready for that part, but I'm going to turn it over to her now. Carita?
I am Carita Hughes. As mentioned, many of you already know how to get into contact with me. I've been working on your retirement applications and your Medicare information for the past week and a half. So let's continue, or let's start with the Medicare presentation as it relates to health benefits. The first thing that you would do, many of you have already retired. Many of you have submitted your PARs or supplemental retirement. Some of you are here just to do research. So I will try to distinguish between those who are supplemental and those who are researching because they want out. With those who are researching, the first thing that you will need to do is submit your HRP 310 that you would get from the health benefit from the Human Resources Department at your location. Those of you who are PARs have already submitted that, so don't worry about it. If you come to the Health Benefits Unit without submitting the HR 310, then we will have no choice but to reject it. We can't do anything until the campus does their part. For the retirement process, the HRP 310 requires multiple signatures. You would probably want to talk to your campus to figure out about how early you should start, because it has to go from your local supervisor up to usually a division head, or depending on your position, the school president. So multiple signatures, you want to start that as early as possible, but check with your campus or your supervisor to get an estimate of how early you should start. Once you're ready to retire, you're going to submit the application for retiree health benefits. For those of you who are doing an SRP, you can start submitting them today. You can, I'm taking them. We've received the information we need from HR, so we are doing the retirement enrollments. Those of you who are doing research, submit it 30 days prior to retirement. On the application for retiree health benefits, I'm getting some questions about the first portion, retiree contact. The retiree contact is someone who can get into contact with you should we not be able to contact you for any number of reasons. So it's usually a child or someone who can speak on your behalf. With regard to the resignation and the retirement date, with LACCD, you must resign one day and retire the next day. Many of you, the resignation is June 7th, retirement June 8th, or 9th and 10th, or June 30th and July 1st. Resign one day, retire the next day. You cannot resign and retire on the same day. With regard to the Medicare information, two situations occur here. Either your Medicare age and you don't have your Medicare information yet, or you are under 65 and you and your partner are under 65 and Medicare does not apply to you. In both cases, you can keep this information blank. It's not necessary to retire. We want to start the process. This actually just triggers me to contact you if I look at your age and see based on your age that you need Medicare, I'll contact you. But you do not have to have this information before you retire. So do not hold on to the retirement application. We have additional information where to submit the application once you're done. On the second page or the back of the application, depending on how you got it, we have the email as well as the fax. You can submit either of those ways to either the email or the fax. I'm not picky about how I receive it. I just want to receive it at some point. With regard to those of you who are 65 and older, Catrella often sends the information on creating a Social Security account. I'm going to ask Catrella to go ahead and drop the link into the chat. The reason you want to go ahead and create the account today, tomorrow, whatever the case may be, is because you can search the website and you can look for pertinent information. I do not need the application for, I do not need the L564. You don't need to send that to me, though it is on the website. Please do not send it to me. I already have a copy of the L564 here at the district office. What I saw someone in the chat asking about earlier, as Julie was mentioning it, is the 40B. You can get documents and forms on the website. And the one that you will need is the 40B. Don't send that one to me either. The 40B is to be filled out by you, the employee or the retiree. The only one that LACCD is going to fill out is the actual L564, and that just tells Medicare Social Security that the reason you did not sign up at the time that you and or your spouse domestic partner turned 65 is because you had employer group insurance, active group insurance. So this is a Medicare waiver to stop any penalties. With regard to Medicare, I'm answering some questions that were in the chat. You will enroll in Medicare A and B. Many of you may have already enrolled in A, but now you're going to use this to enroll in B. Your LACCD plan acts as either it coordinates for a senior advantage type plan or is a supplement to Medicare. And either way, your LACCD plan is going to help you to fulfill the needs of having what's known as Medicare C. And I answer this question in my head and on screen because a lot of you are being told by friends, families, associates, etc., that you need Medicare C. You do not. Our LACCD insurance will provide that coverage that is needed to get, that is known as Medicare C. So you're not going to do anything active to enroll into Medicare C. With regard to what's known as Medicare D, which is the prescription drug coverage, you will not enroll in D as an individual. If you enroll in D as an individual, or because you have other insurance, I know we have some military veterans who have something known as TRICARE. If you enroll in D, you will lose your CalPERS insurance. You will be dropped. Do not enroll in D. However, your insurance carriers affiliated with CalPERS will enroll you into D, and they'll send you the bill. But as an individual, do not enroll into D. With regard to me sending forms to you, I am currently using I'm currently using our secure networks known as KiteWorks. And I'm telling you this because I'm sending these forms out, and a lot of people are thinking it's some sort of spam or some sort of hack or whatever the case may be. No, that's just me working hard, sending out the forms using the KiteWorks system, which is a secure system for the exchange of information. It's fine to click on the link. Once you click access message, it sends me notice that you're accessing it, and it also sends me a password so that I can notify you of what your password is. I prefer this because I can at least monitor who's clicking the link, who's downloading, so I'll know who I have to put a form into US mail for because they did not access it. So this is preferred because it helps me with tracking. With regard to changing health plans, I saw in the chat earlier, someone was asking about the HBD 30. This HBD 30 will come from me. CalPERS also has it on their website, but you can also get it from me. As indicated earlier, it's used for adding, deleting dependents, moving, changing health plans, or terminating coverage. And I say terminating coverage because some of you are 0% vested, not vested for health benefits. Some of you are 50% vested. And you might choose to go into a spouse or domestic partner's plan because it's more economical for you. If you do not send me the HBD 30 so that I can terminate your health plan into retirement, CalPERS will automatically roll you over into the plan that you're in now. And if you're someone who is 0% vested or 50% vested, CalPERS will start charging you. For those who are 0%, they charge you the full cost of the plan. 50%, obviously, you're half of the plan. So if your intent is to go elsewhere, to go into a spouse, then please send me the HBD 30 so that I can terminate your health plans into retirement effective August 1st. With regard to particularly those of you who are doing research, you will start with the resignation form on your campus location. Here, you're going to do either a screenshot or you're going to write down your name, the name of your campus location, your campus person. Screenshot is control, print screen. Then you have to drop it in the background. You would start with them asking for the resignation form. I've seen people go to the individuals at the campus saying, I need the retirement form. And it's so out of the way that it's shocking. So start with the resignation form and start a conversation on what do I need to do to retire. Then they can tell you all of the processes that they're aware of on the campus location. Again, the resignation form they know has to start to give to you, and you start with your local supervisor to get that signature. With regard to your retirement contacts, again, it's health benefits, me, to get certain paperwork, the application for retiree health benefits, as well as the HBD 30 that some of you may need or want to make alterations into retirement. For those of you who need more information on the retirement, including the conversion of unused illness leave, the first thing you need to do is sign up for one of the general retirement workshops, which is where we go into use about the illness leave. We don't go into a lot because that's handled by payroll, by the retirement unit, but we do provide information on that as far as who you would go to. But this is another situation where those of you affiliated with CalPERS CalSTRS for your express benefits report will contact the retirement unit. For those of you who are part of CalPERS, there's nothing you need to do. All you need to do is put your feet up on your desk, because CalPERS, we already know to report your unused illness days for conversion to increase conversion to your pension. We already know to report that to CalPERS. So PERS people don't need to do anything. STRS people, that's where you submit your express benefits report. And with that, my presentation is through, and I guess we're preparing to go into the question and answer in the rooms. Thank you.
I want to call out a few names that I'm so happy are joining us now, and they will be hosting breakout rooms. We have with us Tammy Rowe from Anthem Blue Cross. She will be hosting the room on the Medicare supplement as well as Medicare Advantage plans under the Anthem Blue Cross program, and she'll be able to answer any further questions you might have about it. We also have another breakout room for the United Healthcare Medicare Advantage program that I just figured out through Julie is nationwide. And so with that, she is Sandy Cisneros, and she has graciously decided to once again be here with us to host a breakout room as well. We're going to move on into these rooms, and I hope you have a really great time getting answers, specific things handled, because that's what this is all about. So here we go, everyone. The rooms shall open, and you shall move automatically into those rooms.